Now, the question that's been brewing since the first Ebola case in the U.S. is whether our country is ready for an infectious disease outbreak.
Well, a new audit says no. The report says the government cannot ensure there are enough supplies or drugs to handle a pandemic disease.
But what about here in our state? Our Emma Wright went to find out.
Imagine this. A deadly flu virus pops up in Mexico and quickly begins to spread. Soon, millions of people are sick. Thousands die from the bug that healthcare workers are unable to contain. Sound familiar? This was 2009 when the H1N1 flu pandemic took hold. So are we prepared for another outbreak of the flu or Ebola? A new audit says no. A report says the Department of Homeland Security has wasted much of the $47 million given to them by Congress to prepare for another infectious outbreak. Here at home, local government often relies on federal resources to help in times of need.
We do have a very active influenza surveillance system, both locally and globally, that's looking all year-round for new viruses.
Dr. Zach Moore, a medical epidemiologist with North Carolina's Division of Public Health, says predicting when and where a pandemic will pop up is hard.
There's always new communicable disease threats that are emerging, and so we have to sort of have a system that's not just focused on one particular illness, but ready to prepare to respond to any of these new emerging conditions.
He says healthcare workers and hospitals are always training, trying to keep a step ahead of the next public health crisis. The state last updated its pandemic plan in 2011.
We were successful in responding to that, H1N1, and we work very closely with our public health partners, and they become what we call the technical lead in something like that.
But when it comes to actually treating infectious diseases, the state's stockpile of antiviral flu vaccines developed during the 2009 H1N1 pandemic has since expired. But that doesn't mean there aren't any vaccines available.
The CDC does have stockpiles of medicines, and some of that is located here in North Carolina, and we can get more if needed.
State Emergency Management Director Michael Sprayberry says what the state has used government money for is to plan, and says North Carolina recently purchased 2 mobile pharmacy trailers, one in Raleigh and one in Asheville, to store supplies. Federal money also bought a mass vaccination trailer, medical warehouse, and antiviral warehouse.
Right now, I would say we're not activated, but we're alert and we're situationally aware to what's going on throughout the country, throughout the world.
Do you think the state is prepared for an Ebola pandemic?
If I was just to say, yeah, we're prepared, we can handle it, there's going to be some bumps along the road. We'll do the best that we can, but I would say that we're probably about as prepared as any other state.
That was our Emma Wright reporting. Now, the DHHS says right now Ebola is not considered a pandemic. The disease is not spreading quickly enough to warrant the status, but health officials are not ruling out the possibility that it could become one.